Hello everyone, this is Dr. Praveen Tripathi and with me is Dr. Siddhant who got a wonderful rank of 47 in the NEET PG exam. So Siddhant, first of all, many congratulations.
Thank you. Thank you so much, sir.
So Siddhant, we were just having a discussion before we started the interview and your journey has been a bit atypical. You were initially planning for USMLE and then you switched over to NEET PG. And I think this was your first proper NEET PG attempt.
Yes, it was.
Okay. So, in the very first attempt, getting a rank of 47 and that to making a transition from MLE to NEET PG would have been difficult. So very curious to know about your journey. So, Siddhant, what I understand is you used a mixture of resources. You just a second. A second. You use a mixture of resources, quick revision videos, BTR, custom modules, multiple things you used. So my first question is, did the preparation for USMLE help you with the NEET PG preparation as well?
I think it could help out in a few ways, which I could personally see. The first one was that each USMLE exam is around 7 to 9 hours from step
Okay.
one, two,
Yeah.
and three.
Yeah.
Therefore, I completely felt ready to sit for a 3 hour exam.
Uh-huh.
Content wise, USMLE would be covering all the basics, but once I was getting into the prep for NEET PG, I quickly realized that the depth of NEET PG is way more than whatever they ask in
MLE.
the USMLE exams.
Mhm. But whatever resources you had followed for MLE, maybe first aid or whatever it was,
Mhm.
did you feel that you had to make a major switch while you were doing NEET PG or that knowledge was still useful to some extent at least?
I felt that, sir, in few MCQs in some places, it was the right foundation that I had.
Okay.
Now, for example, I was very strong with my biochemistry from the days of USMLE. Therefore, I felt that for NEET PG, it was more of a breeze for me to go through
Mm.
versus someone who would be doing it for the first time.
Understood.
And having given the three USMLE steps, I felt more ready even for the clinical subjects like medicine and surgery.
So that is why in the final sprint, if I may say the word of NEET PG preparation, you relied mostly on the quick revision videos and the BTR videos, the shorter resources.
Yes, sir.
What about the Qbank? I mean, majority of the students do not use Qbank so much, especially in the last year of preparation. But
Mhm.
you are telling me that you relied heavily on the Qbank. So what was your approach in solving the Qbank?
So if I can tell you the date, um, the whole USMLE pathway that I was on, by around 20 March of 2025, I could understand that this is not going to work out in
Yeah.
this cycle.
Uh-huh.
So I remember 23rd March ko I had started my prep for
Mm,
this NEET PG,
mm,
which gave me around 4.5 months to study.
mm,
And from my days of USMLE, I knew that studying something passively versus actively doing it through question banks, I
mm.
remember it better through the question bank. So
Okay.
I pushed more on that. जो
Mm,
भी mistakes आते थे, I would then review that.
mm,
Wherever I would be getting multiple mistakes, I
mm.
would take out time and go watch the quick revision video.
The cerebellum skew bank to some extent has been designed on the lines of U-word only. I
Yeah,
mean, we also tried adding that educational objective, which is basically something that I have. In fact, I have appeared for USMLE myself. So I
yes,
did
sir.
U-word as well. So I really used to like that educational objective part of U-word question bank. And when we started making it, I thought let's put it in there. So
Yeah,
so did that familiarity help you in that switch from U-word to something like a cerebellum skew bank?
definitely. It really helped out because a lot of times after uh, doing the question when I'm reviewing, there
Hmm.
might be a big stem that is given, but एक ending पे educational objectives can be like a cherry on top or a wrapper to just keep that one point in the brain.
Right. So you would do more of custom modules or would you go subject wise or chapter wise?
So initially in the first 2 months of the preparation, that was March and April, I was doing custom modules by
Mm.
subject.
Okay.
But as I came closer to the exam, I thought that I want a mixed bag because the exam will be mixed bag.
Okay. So you shifted over to the mixed bag.
Yeah.
Late night PYQs is something that you did not use as much, I believe.
I have used it, but not as consistently as some of my other peers at Cerebellum.
Uh-huh.
Uh, I used to feel that I would just like to have a custom module. So I would quickly make that, maybe share the code and solve that.
Understood. What about the live tests and discussions that are held in the mission program? Did you use
Mhm.
those?
So actually, what happened was because I had a lot of things to cover in the time span of the 4.5 months. I had to prioritize some things, and therefore I did not end up using the live T&Ds.
Makes sense. So, because you got just 4.5 months, primary resource became the quick revision videos, the BTR, and the Qbank. So
Yeah,
it's pretty interesting that in your case, Qbank formed kind of bulk of the preparation that you did in the last couple of months. Wonderful.
yeah.
So, Siddhant, what next? What are you planning to take in MD now or MS now?
So my first choice would be MD medicine.
Medicine only. Wonderful.
Yeah,
And
that was what I was also aiming for in the USMLE exams,
yeah.
and I'm gonna stick to my guns and go for medicine.
And maybe it's a blessing in disguise that you are getting medicine in India rather than US because we know the current scenario is full
Yes,
of
sir.
opportunities. So probably it all worked out the best for you. Thank you, Siddhant. Thank you for talking to us. And it was really nice understanding your perspective to the preparation. This is so I've been doing interviews for the last 2, 3 hours, and it's so nice to see the students who got in top 200. They tend to use different approaches but finally reach the same place. Some were using main videos more, some were using live classes more, you were using Qbank more, but finally they achieved what they intended to. Thank you, Siddhant. Thank you a lot. Thanks a lot for talking to us, and best wishes for your future career.
Thank you. Thank you so much, sir.